I'm going to wash my hands. And how are you feeling today?
Good.
Would you be able to state your name, your age, and your occupation for me?
Tyler, I'm 23 and I'm a lawyer.
Thank you. I'm just looking at right now at your general overall appearance and your general state of level of consciousness to see if there's any changes in anything. Have you been feeling any different lately? Okay. When you move around at home, do you use any assistive devices such as a walker, crutch, or cane? Do you have any problems with your hearing at all? Use any hearing aids?
No.
Okay. So first I'm going to take your vital signs. Could you first state your weight and your height, please?
I'm 6 foot, 200 pounds.
Okay. Now I'm going to check your respirations and basically just going to measure how many breaths you take per minute. Okay. I want to take your temperature, which we'll do with a thermometer, and we can check that either temporally or in your mouth. We'll also check your pulse, if I can check your pulse here. What we're checking for is the rate, the strength, and if it's regular or irregular. We'll also check your blood pressure by putting a cuff around your arm, and we'll do that by measuring your arm to make sure that we get the correct size so that we get an accurate reading for your blood pressure. We would measure your arm and take the width and decide the size of blood pressure cuff we would use. We also would like to know your pain scale or your pain rating. We do that on a pain scale. It's the numeric scale where we do a rating from 0 to 10. 0 would be no pain, and 10 would be the worst pain you can imagine. So what would you give your pain today? 3. Okay. And where would your pain be located?
My knee.
And how would you describe that pain? The characteristic would be like aching, sharp, shooting, rubbing.
Aching.
Okay. Well, we would also test your vision on what's called a Snelling chart, where we would have you cover one eye and read off the chart, and then cover the other eye and read off the chart, and gauge what you would view versus from 20 feet away versus what the normal eye would do. And your vision today is 60/20. So now I'm going to assess your face and your head. First, I'll just check the temperature, the moisture on your skin. We're also going to check your facial symmetry. Could you give me a smile? Could you raise your eyebrows up and down? Thank you. I'm going to touch your sinuses and tell me if you feel any pressure or pain. First, I'm going to do your frontal sinuses. Do you feel any pain there? And your maxillary sinuses?
Nope.
There's also 2 other sinuses, but they're just further up in your on the sides of your nose. We're also going to check your eyes today. So can you follow my finger? Thank you. I would check your eyes, your pupils with a light that I would shine in your eye and check how far your pupils would dilate. And I would check both pupils to make sure that they are the same size. Next, I'm going to check your ears. So first, I'm going to inspect just the outer exterior of your ear. I'm going to touch on your ear here. And I'm going to touch on your other. And I'm going to check for the shape and if any deformities and if there's any tenderness in your ears. Do you feel any tenderness in your ears today?
No.
Okay. Then I would use an otoscope, which I would look into your ear canal and check for any redness or irritation, and I would do that in both ears. I'm also going to do a slight hearing test with you, in which I'm going to whisper a little bit over here. Were you able to hear that?
Mm-hmm.
And then I'll do the same over here. Were you able to hear that?
Mm-hmm.
Good. Next, I will check your mouth. So your lips look like they're not dry today. I'm going to check inside of your mouth. Okay. I'm going to check your uvula, which is that dangling thing in the back of your neck. I'm going to have you say ah, and I would look in there with a light and a tongue depressor. Okay, very good. I'm also going to check your teeth and your gums to check for any bleeding, any kind of signs of infection. I'm also going to check your tongue. We're going to do that by having you move your tongue from side to side. Could you show that to me? Could you stick your tongue out? Thank you very much. Next, I'm going to check your neck. And what we're going to do that for is we're just going to check for any symmetry. And then I'm going to feel down the sides of your neck for any swollen lymph nodes. So I'm going to touch your neck now. Okay. Now I'm going to feel your carotid artery, which is the one here in your neck. And I'm going to listen to your carotid artery, and what we listen to is to hear a bruit, and what we don't want to hear that because that means there's turbulent blood flow. So I'll just listen to that here quick. Good. And also check your jugular vein. I can have you turn to the side. I would check from behind your thyroid here. I'm just going to feel on your neck again, feel if there's any swollen. Okay, thank you. Next, we're going to assess your chest. So I look at the overall symmetry of your chest here. And then I'm also going to check the front side and the back side for breath sounds and for percussion. So first, I'm just going to percuss on your collarbone and down the sides. Now I'm going to listen to your breath sounds here. Could you take a deep breath for me? Again. Good. Could I have you face that way so I can check in your back? The first thing I'm going to do on your back here is I'm going to hold my hand in different spots, and I'm going to check for a tactile primitus, and I'm going to have you say 99 while I hold my hand here. So say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
So what normal findings we had is that when you say 99 at the top, we can feel vibrations, and at the bottom we don't feel any vibrations, and both of those are normal findings. So next I'm going to press down your back. Okay. And now I will listen to your breath sounds from the back. When we listen to breath sounds, we're checking for adventitious sounds, such as growls, crackles, or wheezing. Let me take a deep breath. Thank you, you don't sound very good. Next I'm going to check your heart sounds so you can face front again. What I'm going to do is listen to the four main prominent spots on your heart here, and we're going to listen for the lub-dub sound that is well known. So you can just relax. So next I'm going to check your arms, and what I'm going to have you do is, do you have any problems with range of motion? Can I have you shrug your shoulders for me? And can I have you move your arms out? And the other? Thank you. Okay, I'm going to check the strength, so I'm going to have you push down on my hands with both hands. I'm going to have you push down while I push up. Okay? Now I'm going to push down while you push up. Very good. Next, I'm going to check your abdomen. So I'm going to have you lay down for this part of the assessment. So normally I would do this while lifting up your shirt and checking against your skin, but we will not do that today. So I would check first for the symmetry of your abdomen, and I would check your umbilical area, which is your belly button. Then I would listen to your bowel sounds, and listening to bowel sounds shows that your intestines are working correctly and that your bowels are functioning. So I will check those bowel sounds first. And then I'm going to listen over your aorta. And vascular spaces. Next, I will percuss on your stomach, and this will just give me the reverberations from your organs. Next, we're going to palpate, which means that I'm going to push down, and we'll start out lightly, and then we'll go a little bit deeper. And what this is going to be that we're going to feel the different organs in there, such as the spleen, the kidneys, and the liver. So, I'm going to do this by placing one hand under and one on top. And now I will do it a little deeper here. Any pain or tenderness when I touch any of those areas?
No.
Okay. Have you been passing gas out your bottom today?
No.
Alright. Any nausea present?
No.